of this week, we formally announced that the entire NCAA Division I men's basketball tournament will be played largely in central Indiana, with four of the venues located right here in Indianapolis. This is exciting news for our city. As we plan for an event that will be unlike any other that we've experienced, it's, as I said on Monday, it's a once in a lifetime opportunity. I also want to assure everyone that we are working closely with the NCAA, with Dr. Virginia Kane and the Marion County Department of Public Health to ensure that these games are held with health and with safety as a top priority. As a reminder, this will not be the first sporting event held in Indianapolis during the pandemic. We've safely hosted youth, collegiate, and professional sports across multiple venues over this past year. The Indiana Sports Corporation, the Indianapolis Marion County Capital Improvement Board, and our Marion County Public Health Department are a well-practiced team with the experience necessary to put on these upcoming games. I am confident and I know that our state and local health departments have been in constant contact with the NCAA on health measures for each and every game. Unfortunately, it is too soon for Dr. Kane to make a recommendation or determination if fans will be permitted to attend in person. But as we have seen time and time again, and this bears re-emphasis, our behavior now, our behavior today determines our public health environment tomorrow. So the steps that we collectively take today will help determine the safest public health environment possible when the tournament begins in March. So, as always, wash hands frequently, wear a mask in public, and keep 6 feet of distance from anyone you do not live with. So I'd like to turn briefly now to schools. Recent data will permit us to have a much more targeted approach for school closures. Dr. Kane will be on in just a minute to provide specifics. But I will say that parents can expect greater clarity and a measure of relief around this difficult issue in 2021. Let's turn to vaccines for just a moment. Of course, there are many reasons to be hopeful in this new year. Chief among them, though, the ongoing deployment of vaccines in our city. I am very pleased to announce that for the first time, the Marion County Department of Public Health will be administering the vaccine. Beginning Monday, doses of the vaccine will be available by appointment to eligible recipients. Starting Friday, residents can register for their appointment utilizing the state's portal at ourshot.in.gov. That's ourshot.in.gov, or by simply calling 211. Right now, eligible populations would include medical professionals, law enforcement, and as we learned yesterday from Governor Holcomb, all residents over the age of 80. In the coming weeks, as we receive additional guidance from our state health officials, eligibility will expand to other age brackets and other professions. But even as our vaccination capacity ramps up, we must work equally hard to reach residents and educate them on the importance that this vaccine will play in getting them and our entire community back to everyday life. In 2020, the spread of COVID was rivaled only by the spread of misinformation about COVID. We must do better. In the coming days and weeks, I will be calling on faith leaders, community leaders, and my fellow elected officials to help connect residents to the vaccine, as well as spread factual information about the vaccine. This is especially critical among vulnerable and minority populations. Our city will be relying on trusted voices to get the word out. December was our toughest month yet, not just in Marion County, but throughout the state of Indiana, and in fact, throughout the world. As expected, we are seeing a bump in transmissions following the holiday season. We are no doubt in for a tough January. I truly believe, however, that we are seeing light at the end of this all too long tunnel. In our excitement and in our anticipation, we cannot let our guard down. Even with a vaccine beginning to make its way into and throughout our community, once again, we have to stay smart. Wear a mask in public. Remain distant. Wash your hands. And when it's your turn, please get your shot. So, with those admonitions in mind, I'm pleased to turn things over to the director of the Marion County Department of Public Health, Dr. Virginia Kane. Doctor.
Things that we have to tell our residents in order to make our community safe. So I'll give the community an update status report of where we are with community spread. If I can have my presentation. I'll take the next slide. Thank you. So one of the things that we have realized is that we had used our gold standard in terms of we're looking fantastic if we have a positivity rate of 5% and below. And we had done well for many months. If you can see the lower graph, where back in early October, we were at a 5% positivity rate or lower for about a 2-week period. But since then, we've seen changes in the stages of reopening. We noticed and started to see our positivity rates climb, and they rose to at least over 15% at the beginning of December, primarily because of our Thanksgiving holiday. And this slide shows that we have basically, since the Thanksgiving holiday, from December the the 7th and the 1st that we got down around about during the just before Christmas holidays, we had reached in the 12% positivity rate. But again, when you see 1.3 million travelers in the airport arenas, we're like, no, like just any other community, we have had the Christmas holidays hit us. And so we're now seeing our trend go back up as a result of the Christmas holiday surge. And as of December, the end of December, just before the beginning of January, we reached a positivity rate of 15.9%. Next slide. With our newly confirmed cases, back in Thanksgiving, we were hitting several days of over 1,000 cases since Thanksgiving. But again, we saw that our cases gradually had come back down from over 1,000 some cases. But just before the Christmas holidays, we had dropped our cases to below 600 cases at that time, leaving us with a 7-day average of 656 cases at the beginning of January the 2nd. Next slide. How are we doing in terms of hospital admissions for persons with COVID-19 positive tests? We have basically been very fortunate when we look at our hospitalizations for individuals who were positive for COVID-19. We've been basically sort of flat since we saw a little surge during our Thanksgiving holidays. And so although based on Marion County residents, we've been sort of flat with our hospitalizations for COVID-19, averaging about 22 hospitalizations per day starting the beginning of January. Now, while I say this, these results are basically for Marion County residents. You know that we have a lot of surrounding counties, and we have patients from other counties that are sometimes in our hospitals. So our hospital system beds are full, but in terms of what percentage of them are Marion County residents, we've been holding basically flat and doing a great job with our hospitalizations so far through New Year's Day. Next slide. And I'll just add to the same thing, even though we don't have a slide up here, the same thing has been the case for our emergency room COVID symptoms. So we've been basically flat too for the last 2 weeks in our emergency room visits with people who have symptoms with maybe just a slight increase. And our deaths for the last 2 weeks have been basically flat, where we're averaging 8 to 9 deaths per day, but definitely a significant increase compared to early October, when we were only experiencing 1 to 2 deaths a day back in the beginning of October. Next slide. So how do we compare our county in terms of what's going on in our surrounding counties? Well, this slide will highlight that all of the counties, except for Boone County, saw a decrease from the beginning of December to the beginning of January the 5th. We saw a decline in our new cases per 100,000 residents, whereas you saw in Marion County, we had 99 cases and we've dropped down to 69 cases. All of us saw a decline significantly, but we're already looking at our Christmas holiday surge. So if you look at this map, you'll see at the tail end, and Boone County, it just seems like they just started just a little bit earlier than us in the other counties, but all of our counties are going to see a little surge now because of the Christmas holidays and the new cases crossing their counties. Next slide. Now, when we look at the age distribution of our confirmed cases, I do want to highlight one major point that when we look at our seniors, remember they took up 40% of our cases when we had this big outbreak in March and April, and we were doing very well with the low proportion of all of our cases. If you were 60 and older, we are now starting to see a slight increase in seniors being a part of the proportion of all of our total cases. So they have now reached up for the month of December 19% of our cases, or you can say a fifth of our cases. So that's something that we really have to keep a lot of attention to because they have the higher risk for hospitalizations, but they also have the highest risk for deaths or morbidities, mortalities as well. So making 19% of our cases in December. But we continue to have the same percentage if you're in the age of 40 to 59 of almost 30% of our cases. And our largest number of contributors to our COVID-19 cases are in the age bracket of 20 to 39. They're the largest contributing age group to our COVID cases occurring in our community, with our school children under the age 19 and younger making up 13% of the cases that occurred in the month of December. Next slide. Now, this is probably the most important slide I want us to pay attention to because this is a metric that we use to make the determination that it was safe for our school children to return in operations January the 4th. This map highlights the number of cases that are occurring per 100,000 residents. That very bottom line are children less than the age of 5 years of age. And if you go back to the beginning of December, you will see that that rate is way below 25 cases per 100,000 populations. Then you look at the red bottom line, and you'll see this is all the school children from K through 12 total. And in this case, you will see that for the month of December and January, we were at an average of about 35 some cases per 100,000 populations. Now, when we did this data, we used the same data and we went back month to month to month, all the way back to September. And these trends have remained being much lower than the average of cases for community spread. And when you looked at our older adults, they were reaching 69 new cases and being fairly steady. But the age group that has had the largest number of new cases has been that age bracket, college age bracket of 18 to 24 years of age. But look at this map closely, and you will see for all of those three lines above, and even our school children age, we saw a significant decline in these cases occurring just before Christmas, but we're now seeing a slightly increased bump. But clearly, those lines of the red line in our gorgeous green bluish line highlights that their children are not getting the number of new cases nor transmission rate compared to the rest of the community. Next slide. So, the thing that everybody's been waiting for is we got a lot of input from residents, teachers, administrators, school administrators, staff about could we develop a system whereas instead of using so much a community metric, that if we reach this community metric, then we would have to close all the schools down from a community one dimensional metric, could we design a system that would allow individual measures of that school to determine whether risk mitigation efforts needed to be made, so that if a few schools or community met this metric, I wouldn't have to close all the schools. So it depends on the work, individual work, infection control, and other issues that are occurring in your school determines whether any changes need to be made or people need to be concerned about that. And you can do your own measurement to know where you are in terms of risk, where you might have to have some major concerns for your students or your faculty or your staff in your school systems. So this is a new metric where we are looking at comparing individual school positivity case rates compared to what's happening with the community rate. And it's color coded, very similar to our prior system. So a school case positivity rate means the number of positive cases you have had in the past 2 weeks compared to all of your total students that are enrolled in person in your school, compared to the community case positivity rate, which is the total number of cases we have seen in the last 2 weeks over the total number of residents in our community. So if your positivity rate is less than 25% or equal to 25% of the community rate, you're doing fantastic at green. If your school's case positivity rate, which combines the students and staff, is greater than 25%, but it's less than or equal to 75% of the community rate, this is sort of like a caution. It's telling you, hey, your cases are starting to increase. We want you to pay attention to this, okay? And then if you reach our orange zone, and that is that your positivity number of cases is greater than 75%, but less than or equal to 100% of our community rate, then you're just in that zone where you may, if you're having any more cases, you are going to reach the hot zone, which is our red zone, which means you have a greater number of positive cases in your school system than what's occurring in the community. Next slide. So this, based on these color codes, is when the Marion County Public Health Department would intervene. So if you're at the green level, we just monitor you. If you're at the yellow level, we'll continue to monitor. But once you reach that orange zone, that critical component, before you reach the hot zone, that's the time we want to work with you. Look at some risk mitigation strategies. Make some determinations about what changes can be made into your school so we never have to close a school. So we're going to work with you at that particular time, our local health department. And then we will continue to work with you if you make the hot zone. So we want to decrease that incidence, but it does not mean you have to close your school at the red zone. It will all depend on an investigation related to what's happening specifically in your school and what's contributing to your cases, whether how much it impacts the other students and staff in that school system. Next slide. So we're adding this to our public health order that all schools must report their COVID-19 positive cases for both your staff and your students to the Marion County Health Department within 24 hours of learning of a positive case. Now, we're going to do something a little bit different because most of you have already been reporting to us. but we need to know the difference if you're reporting a positive case to us, whether that person is in school in person or are they learning virtually, staff or student. Because if you are a student that's learning virtually, but you're positive, we know if you're positive, you contracted that outside the school system. So it's important for us to know that distinction related to the positive cases you're reporting to us, whether it's a staff person or whether it's a student. Next slide. So now the mayor made me do this, so I want you to look at this slide very carefully because we want to know that our teachers in our schools are training everybody with the proper way of being able to do math. All right. So I'm going to give you an example of how this metric works for school. So let's say we have a school that's got 25 staff and 275 students. Let me just say the mayor passed this test. So wherever he got his school training, you have to applaud his teachers, okay? And maybe his parents helped too, I don't know. But he's passed this test, okay? But say you have 300 students that are attending school in person. And in the past 2 weeks, they only had 2 cases. Now, our Marion County community rate is 89 cases occurring daily. So whatever your rate is, I've got to make sure that your school positivity rate is not greater than 89 cases, because it is, you in that red hot zone. So what we do is that we put the 2 cases divided by the total number of students and staff. And that results in 1 case for 150 persons. So we got in that school. Then you have to put that 1 over 150 multiplied times 100,000 over 14 days to give us the daily average cases. And so this school had a total of 47 cases, okay? But when we commuted it, we looked at it compared to the community rate. The school rate was 53.4%. And because that 53% is between 25 and 75%, they are in the yellow zone. So they're doing fine. They've seen an increase of their cases, meaning that they probably had 0 cases 4 weeks ago. So they just went up 2 cases now in the last 2 weeks. So the yellow zone is just saying, hey, your cases are increasing. We want you to be vigilant and watch this, but you are way below community positivity rate, and so you're coded in the yellow zone. So thank you, Mayor, for using you as our I won't say a guinea pig, but you know, for helping us make sure that our calculations were correct. Now, next slide. So the mayor's already announced this, and this is really, really important to our community and addressing community spread. That eligible residents for this new vaccine, the health department is excited about being able to offer our own vaccines now from the health department starting on Monday. But eligible recipients, from as a reminder, 80 and older, and any licensed and unlicensed healthcare workers, first responders, law enforcement, firefighters, EMT, are eligible to get this vaccine. The appointments will be scheduled starting tomorrow, Friday at 9 a.m. If you looked up our site today, it would only say our appointments are already taken. So I don't want you to be discouraged if you peep and look at the site today and schedule an appointment today. So, but if you wait tomorrow, starting at 9 o'clock, you will see that all of our appointments are open, and they're at this ourshot.in.governor, available for you to make your appointments. And next slide. These are our clinic hours. We're open Monday, Wednesday, and Friday from 8 to 5 p.m. Tuesday and Thursday, we're open from 10 to 7 p.m. And Saturday, we're open 9 a.m. to 1 p.m. But these are appointment only. They're not walk-ins. So you really need to get the appointments scheduled, okay? And if you have any questions, you can call us at our Marion County COVID-19 call center. So 317-221-5500. 317-221-5500. A press release will be coming out soon, and so that information will be available. Thank you. Thank you, Mayor. That's it.
All right, as always, we will be taking questions via the question and answer chat located at the lower right-hand side of your screen. First up, we have Mickey Shuey from IBJ.
Hi, Mr. Mayor. Thank you for taking the time. Quick question for you related to the NCAA tournament. I know we're still several weeks out from that, but is the city and is the county health department, Dr. Kane, are you guys considering increasing the or lifting some of the restrictions on restaurants in the downtown area, given the likelihood that people will want to come downtown even if they can't go to the games to watch at sports bars and other restaurants? Is that something that's being considered right now?
Taylor, you want to handle that since you're our liaison to our coordinating committee?
Absolutely. Dr. King, do you want to take sort of the public health aspect, and I can talk about our Dine Out program and what we're talking about around that?
So there's always a consideration that we're looking at our businesses, because we want to try to find a nice balance of businesses versus restaurants. And so we try to look at that very carefully, and that's something that we definitely review on a weekly basis. But I can just say right now, at the current point, we're not able to increase our restaurant capacity, but that's something that we definitely want to look at very carefully, because we're going to have family members for sure of all of these 64 teams coming in, over almost 500 people, and that's just the relatives and members of the participants. So you're going to have other extended sports people, media, and things of that nature. But that is something that we are monitoring very, very closely, and hope we can have some good news during that tournament.
Mickey, I would also say that on the city side, our city departments have already started engaging with business corridors, with areas in which we really saw success around our Dine Out program, and thinking about how we can deploy some of those same tools to be able to utilize additional space for those restaurants and venues during the NCAA tournament.
Thanks all. Next up, we have Erica Herron of IndyStar.
Thanks. I have two questions. First, do you have any idea how many schools would have ever hit this red threshold, going up to this point?
Mark, I think that's a great question. Using our new metrics, we look like we would average about 12 to 15 schools, somewhere in that nature of the over 220 schools we have in our community.
Is that over the course school year?
So what we had to do was we actually just used our metrics and we looked at it by month per month. So we were averaging about 12 to 15 schools per 30 days in the different months, to make sure that we didn't have some kind of outlier month, so these metrics wouldn't work. But what happens a lot is you don't know if some schools will cross over in the following months, so that they may not be able to correct their numbers, less than a 2-week period. So we think there'd be some of those schools will be overlapping over several months, but it beats having to close down 80% of the schools. So we're looking at roughly about 10 to 15% of our schools would be impacted by the new metrics.
Thanks, Dr. Kane. Next question is Russ Dodge from WITT.
Okay, this is probably both for Dr. Kane. Two questions. First off, if the demand is very strong for people getting the vaccinations through the health department, will you expand the hours? And also, are the age breakouts?
The last part of the age, and then it's kind of stopped.
I'm sorry, something cut in on me there. I was just saying the second question was, will the age breakouts that will be done for Indianapolis be different than the age breakouts for the state as far as the priorities for the vaccinations?
So first, let me just say that I am on the Indiana State Department of Health's Vaccine Advisory Committee. And so I think it's so critical that this is really structured and planned throughout the state of Indiana, and we're all cognizant of what each other is doing and how we assist each other from a regional standpoint. So in answer to your first question, yes, we would expand our hours in time and maybe even the number of people providing the vaccine in order to quickly as we could to get as many people vaccinated as possible, okay? And so we want to try to adapt into what's happening in our community and what's important in order to make sure we're able to reach every able body who's eligible to get vaccinated. So that's my first response to your answer. Secondly, the decision by the state had a lot of experts across the state, different specialties, different areas. I'm an infectious disease specialist, but I also deal with a lot of people who are vulnerable, may not always have the resources, may not have a primary care provider, may not have transportation to get where they need to go. We provide that input, and we all agree that we will probably go the age route because we want to reach the people with the highest risk for hospitalization and the highest risk for deaths. And we think that's really important. But the most important point about that is we don't want our hospital systems overwhelmed like we're seeing in Los Angeles, California. If I'm having a heart attack, how do I get a hospital bed? And I may need to be in the critical care unit. But we have to protect our essential healthcare workers because if they're sick, they're not there. How do we respond to a major epidemic? So there's a lot of thought going into how we make our decision-making process, and we feel pretty good about the recommendations that are coming from the state where we local entities, local health authorities have had great access to providing our feedback related to the strategy. So I'm just going to say it up front. Hey, I'm going to give kudos to Dr. Christina Box, Dr. Lindsay Weaver for their leadership in terms of this process. It can be complicated because you do have to work on the federal level and you have to have an idea of how much vaccinations you can receive, and you have to be very adaptable to be able to respond and make changes based on what's happening in our state and our communities. And we're going to knock it out of the park, okay? Just so you know, we're going to knock it out of the park, just like, sorry, Mia, for this favoritism, but just like the Colts are going to knock it out of the park in the playoffs, okay?
Apologies, I interrupted Erica Aaron's second question, so we'll go back to her real quick.
Oh, no problem. Thank you. So I wanted to clarify then, does this mean that high schools can go back to in-person like 100%, or do they still need to have a hybrid schedule? Like what happened to that old guidance based on, like 11%, 13%, et cetera?
So some of them may have to go back to the hybrid arena as opposed to everybody being there at one time. We were really trying to evaluate that situation, and but we're leaning toward the hybrid model, unless they can assure us that they can have every student 6 feet apart. But we're also looking to see if we can lower that 6 feet criteria, which we have at 3 feet for our elementary students.
All right, thank you. Next up is Logan Gay of Wish TV.
Hi, thank you so much. Today I'm focusing on making the 80-year-olds making the appointments for tomorrow. I just wanted to know if I could get a comment just about how you think this will impact them getting vaccinated will impact the community.
I think it's going to be huge how they get vaccinated because they were our highest risk individuals for being hospitalized. And number two, their highest risk for going to critical care and being intubated. Listen, having COVID-19 is not a mild thing compared to maybe if you were younger and you're a young adult, you may have mild symptoms. It is much more deadly the older that you are because your immune system wanes as you get older. And there's a smaller percentage of people, significant, that has long-term chronic side effects after the acute infection is over. So that they can have problems with their brain with a COVID-19 infection, memory problems. I can't do simple calculations. I can have issues with short-term, long-term memory. But you can impact their heart. You may have an inflammation of the heart that could contribute to you developing heart failure or just chronic fatigue syndrome. Who wants to wake up every day and they're just exhausted and they really haven't done any exercise? But these are some of the complications that are long term after your acute infection is over that we want to avoid and prevent with the vaccination.
Thanks, Dr. Kane. Up next is Erica Washington of Chalkbeat, Indiana.
Hi, I just wanted to know if there was a particular area where these 12 to 15 schools are located that would be like on high alert for the district, for the county. So it's a follow-up from the other Erica's question.
No, they were dispersed all over the Marion County. There was no one district or no one area where we could be able to pinpoint something of that nature based on our review.
Thanks, Dr. Kane. Next up is Amelia Pack Harvey of Indy Star.
Hi, yes. In regards to the vaccination, specifically for city employees or first responders, I guess, that can sign up beginning tomorrow and then moving forward, has the city created any sort of policy or recommendation it'll be giving to staff as we roll these out in terms of whether or not they should be receiving the vaccine?
Paul, you want to take that?
Yes, sir. So the city, in partnership with the health department, are putting together vaccine recommendations and guidelines for our HR department so that we have a similar message both at the health department as well as at the city when it comes to who gets vaccinated, when, and then obviously some people may not want to, and then how we can handle those issues when they present themselves.
Thanks, Paul. Next up is Sherry, also with the Star.
Hi, thank you. Thank you for being so patient with all of us from the Star bothering you. I appreciate it. I actually have two questions for Dr. Kane. One is that we're hearing a lot of concern about people who are not in eligibility groups who are getting, quote, leftover vaccines in other counties. Is there a plan for dealing with kind of those outstanding extra doses? People are asking, can they sign up or, be on call? And the second question is, what specifically are you doing to reach out to underserved populations, especially among the senior populations that may have transportation difficulties, issues of that in terms of getting to spots where the vaccine is being offered.
Let me say, you gave me two questions, so give me one question again at a time. Just give me one question, I'll answer right quick.
Okay, sorry about that. Do you have a contingency plan for leftover vaccines that people can?
So definitely yes. So one of the things that I think that has been sort of good for us, having our regional approach with our other my other peers in other counties. Someone may do their appointments, and they may have appointments going like through April already. So before they can get a vaccine, and I'm in another county, and I may have a lot of slots, and I'm not even filling up my slots. So we're trying to develop a communication and action where, because most of our surrounding counties are just like 30 or 30 minutes away, making sure that we don't have a single slot where our vaccines are not being used. And the state is working very hard on this process with us. But we won't, I can't imagine that we would have unused vaccine that's not being used. And if so, you report it immediately to the state, and then they can make sure about where does that next vaccine go. So it'd be a coordinated effort between the local health officers working with the state health departments for any sites where it doesn't look like those vaccines are going to be utilized. And we're going to be having multiple sites in each of the counties, especially the larger counties, so that one site may be overwhelmed, and so let's how do we provide assistance to this other site where that may not happen. Now let me go to the next question, and that is vulnerable populations. Okay, low income people that may be in shelters. So we have had and worked a long time, a lot of experience with these populations, where we try to use what we call those neighborhood leaders, or those leaders related to that particular group. So we're very strong on our faith-based communities. So we'll be shortly getting communications to all our faith-based partners, getting on our faith-based media. Some of us are fortunate enough to have print newspapers where we can get this message out. But we do a lot of community engagement, and we deal with well over 200 some organizations. SACOR is one of the most critical components for us, as well as AARP, but getting that message out in their vehicles to say, hey, who are the people that you service if they're over the age of 80? Could you send a communication letter out about this? We'll provide flyers for folks so they can send this out and say, this is where you can register. If you have any questions or concerns, let us help you. Now, we also have people who may have disabilities. They may not be able to come to our site. So we know that we're going to be working with the Division of Family Social Services, where we have their mobile units to go and try to reach with nurses to vaccinate those individuals who do not have the ability to come to our sites. So really trying to work on this. The registration is all in English. So how do we help and provide assistance to people who may speak different languages? So we have a number of those mechanisms in place to try to address this issue.
Thanks, Dr. Kane. We have a follow-up from Logan at Wish TV.
Yes, I have two questions actually. One is, how do you think seniors feel about getting this vaccine? Do you think they feel this is a big step to getting their lives back? And then the second one, have you heard any questions or concerns from seniors?
So let me just say, we've heard concerns about the vaccine from a number of people, no matter what the age, what the race, what the income. So we have had concerns from everybody, and everybody should be. They want to know about this new vaccine. It's using a new platform of technology for this vaccine, and they hear about side effects, and they want questions and answers related to that. But they really want to know, how effective is this vaccine? And it's got one of the highest effectiveness related to this vaccine compared to almost any other vaccines that we've had in the past at 95%. One of the vaccines is almost at 100% in preventing you from being intubated or have to be placed on a respirator. So that's huge. And because their immune system wanes, it's way more protection, prevent them from getting hospitalized or even just having a severe condition. But it's all about our education, all about our community outreach, and having the ability to be able to answer their questions.
And we have time for one more, and that'll go to Tyler Fenwick of the Indianapolis Recorder. We're going to try the microphone, and if not, I'll just read it, Tyler.
Can you hear me?
Yep.
Okay. So, Dr. Kane, I'm wondering if you can elaborate on how the health department will work within the African American community to promote the vaccine.
So just so you know, Tyler, we're trying to work on the Indianapolis Recorder to do a webinar to get that message out to the community. So negotiations have already been started, working with Ashkenazi Health to do that sponsorship with your owner and your editor. So we have to get the message out. So based on organizations and allowing us to come and get the message out. So I'm giving a message about vaccines tonight for NAACP. I'm giving a message tomorrow morning for the Racial and Ethnic Network tomorrow morning. So we're lining up the organizations getting the message out. Channel 40, which is our faith-based media, will be doing a webinar next week, I believe Tuesday, in regard to that, and look for a campaign to be started within a week. So we have reached out to a lot of our faith-based ministers. Reverend Jeffrey Johnson is helping to spearhead that, but we're reaching out to a number of places. How are we getting the education to our homeless and our shelters? So we have a number of strategies starting on them, but you guys are the key, okay? You do that webinar for us, hey, we'll knock it out of the park. Thank you.
All right, thanks everybody for tuning in. Momentarily, we will send out today's public health slide presentation. If anybody needs help practicing their calculation of the school positivity rate, I'll have them reach out to Dr. Kane directly for a worksheet. All right, thanks everybody. Bye.